Good morning, everyone, and welcome to our weekly COVID update. I'm Carrie Schutte, the Public Information Officer for the Shasta County Health and Human Services Agency. With us today, we have Robin Schurig. She's the Director of the Public Health Branch of the Shasta County Health and Human Services Agency. Karen Ramstrom is the Shasta County Health Officer. Judy Flores is the Superintendent of Schools for Shasta County. Mark Mitchelson is representing Shasta Regional Medical Center. Robert Folden is representing Mercy Medical Center. And Brandon Thornock is representing Shasta Community Health Center. Welcome all of you and thank you for being here with us today. We'll start with the numbers as we always do. Today we are going to be reporting 203 new cases from yesterday. We've got more than 1,000 active cases as of now. We've got 89 people in the hospital, including 24 people in the intensive care unit. And we unfortunately have 8 new deaths to report today. Those are a man in his 50s, 2 women in their 60s, 1 man in his 70s, 2 women in their 70s, a woman in her 80s, and a man in his 80s. We will start with an update from Robin Schurig.
Thank you, Carrie. Good morning, everyone. Yesterday, we announced that Shasta County has the highest case rate out of all the counties in California. The CDC's 7-day case rate for the most recent 7-day period in Shasta County is 785.76 cases per 100,000, and that's up from 714.68 yesterday. Anything above 100 per 100,000 is considered high transmission. We continue to see these extremely high numbers because of the Delta variant, which is much more highly contagious than previous strains of COVID. And while some other parts of the state have begun to come out of this surge, we typically lag behind the rest of the state, both in terms of when surges begin as well as when they end. But our high numbers are also being driven by the low vaccination rate in our county. So it's possible that this surge will continue longer here simply because there are more people who are susceptible to infection. Our vaccination rate is inching up slowly, with the latest data showing 46.8% of eligible Shasta County residents, those aged 12 and older, fully vaccinated, and 56.6% with at least 1 dose of vaccine. This is still very low compared to the state as a whole, as well as the nation. For hospitalizations, as Carrie mentioned, there are 89 people hospitalized with COVID in Shasta County, including 24 in the ICU. As we've reported previously, the vast majority of our cases, hospitalizations, and deaths have been in people who are unvaccinated. We did see our second death in a vaccinated person this week, but we've seen many more deaths in unvaccinated people, including 15 in the last week alone. And several of those were people in their 40s and 50s. Again, the reason we share this information is in order to convey the effectiveness of vaccination against infection, but especially against severe illness and death. Vaccine remains the most effective way for us to protect ourselves, our families, and our community from COVID and from severe illness or death from COVID, including providing protection to those under 12 who aren't yet eligible for vaccine. Being vaccinated also means you don't need to quarantine and miss work, school, and other activities if you're exposed to someone with COVID, as long as you're not having symptoms. And of course, in addition to vaccination, it's important to layer on the protection. Other things people can do to reduce their risk of getting COVID or unknowingly spreading it to others include masking, avoiding crowds, especially indoors, and staying home if you're sick, except to get tested. Those are my updates, and I'll turn it over to Dr. Ramstrom.
Thank you, Robin, and good morning, everybody. Well, I had a little bit of a hard time trying to figure out what to say today. It's just hard to know what will influence people to take action. We're in a really, really bad place. Our case counts are super high. Our hospitalizations and these deaths are so sad. Families losing loved ones unnecessarily. Our healthcare facilities are just tapped out. Our healthcare workers are exhausted. Employees really across all sectors are carrying the load for their coworkers because they're out sick. So we really need more people to engage in embracing the prevention tools that we know really make a difference. And it's really just not that difficult. These aren't scare tactics. It's our reality, and the solution relies on us. Only we can actually make a difference in terms of reducing our case rates and transmission in the community. I was asked to comment on monoclonal antibodies. We've been working really hard for this last several months with our healthcare community to increase capacity for providing this medication. It's a complicated and involved process, unfortunately. They are EUA authorized and do make a difference in outcomes, but it's involved, and you have to receive them in a really timely manner in order for them to make a difference. Our healthcare providers are really, really busy and would likely prefer that you get the vaccine, which doesn't require nearly as much work administering a medication as monoclonal antibodies do. So we really prefer prevention. If you're vaccinated, you know, you could develop immunity without becoming ill yourself or infecting other people. If you're infected, the monoclonal antibodies can help you, can help protect you from severe illness. And that's great that we have that option, and we're working on increasing the capacity. However, it means you're also going to get sick, and you potentially could spread the infection to other people, other loved ones who in your circles. It's just a messier way of developing immunity. So please, please, please mask thoughtfully, seriously consider vaccination if you are not vaccinated yet. Encourage people who are older adults in your world, if they're not yet vaccinated, please help them to get vaccinated, and avoid mixing and crowds, especially indoors. Your behavior really makes a difference. It really matters. It can protect people, or it can put people at risk. That's it. That's all I have today. Thank you.
All right, thank you, Dr. Ramstrom. Let's go over to Judy for a report from our schools.
Well, good morning. So Shasta County Public Health has been able to change their timeline for analyzing and sharing the school data. So in the past, I've said that data will be available later in the afternoon. So when we think about 14 days, last 14 days, so through September 14th across K-12, there have been 176 cases reported in that 14-day period. And that's spread across 51 different K-12 school settings. When we dig a little deeper into that 14-day data, 46 of those cases have come from children ages 5 to 13, and 54 of the cases have come from 14 to 18-year-olds, and 59 are within staff members at school. And so that kind of gives you the 14-day average. As I've done the last 2 weeks, we captured yesterday point-in-time data for September 14th. And so as of yesterday, and this is just those identified yesterday, so students who were in modified quarantine, there were 380. Which is a decrease from the previous week of almost half, 245 fewer. But our numbers for those in quarantine at home are about the same. So 1,588 students are in home quarantine. The previous week it was 1,663. In terms of positive cases yesterday across all schools, 240 students were experiencing a positive case, which is an increase of where we had been the previous week by 14. As we think about school staff who are home on quarantine, we had 119 school staff home on quarantine across all of our schools. Which was a decrease of 15, but still extremely high. 51 school staff were home experiencing a positive case, which was a decrease of 14 over the number on September 7th. As you can imagine, contact tracing within schools is a tremendous amount of work because all of the places students and staff go. And so it's really important to encourage families to have students stay at home if they are showing any symptoms, and to provide testing if they are sick. As of today, we have just one school closed. That is Montgomery Creek School has closed for the rest of this week, and they'll be transitioning to independent study for next week due to positive cases and quarantine within staff. And so I think that's where I will stop for today.
All right, thank you so much, Judy. Boy, that's a huge impact. That's a lot of people that need to have substitutes and all of that. That's a sobering impact on your schools. Thank you for sharing that. Let's go over to our healthcare partners. Let's start with Mark Mitchelson.
Thanks, Carrie. So really not much of an update from last week. I think really this week is just kind of enforcing that, even though this isn't just a disease for the elderly, although the people that have passed away yesterday were a bit older, we are seeing a significant increase in our very sick patients, many of them in their early 20s. So, it's one of those things where it's everybody, it's everywhere. And just because you're young and healthy really doesn't mean you're invincible on this disease. So just be careful out there.
Thank you. Well said. Let's go to Robert and then Brandon.
Good morning. Yeah, I think the only other thing I'll talk about today is, the challenge we really have is that we're not able to operate like a normal hospital, if you will. So we have many routine surgeries that we're having to postpone. So part of the challenge as we go through this again are for those people that have an other medical condition that are having to postpone, their care. And, we've had tremendous support from our surgeons, tremendous support from patients being understanding, but when you're at the point where you need a surgery and your personal life is impacted, that's creating a challenge now as well. So just back to, it would be great if we could increase our vaccination rate within our county, because the reality is, I think I mentioned this last week, you look at our county, compare it to San Francisco County or another county that has a high vaccination rate, the number of hospitalizations are significantly different. So just want to encourage people to vaccinate.
All right, thank you, Robert. And Brandon.
Thank you, Carrie, and good morning, everyone. At the Shasta Community Health Center, we're still screening a lot of patients who are presenting with symptoms. Of all those folks who we're screening, we're still seeing around a 10 or 11% positivity rate, which I think is somewhat reflective of the county numbers as a whole. I just wanted to add this morning, in light of how everything went with the governor recall, the results of the vote, I wanted to go spend some time and talk with some of our staff and kind of see where they were at, because we still have a lot of folks who are unvaccinated. And it was actually quite refreshing to me. I spoke with a number of folks who felt that there was a lot of misinformation and they had a lot of apprehension about getting the vaccine. But in the end, they did decide to get the vaccine. And now they're saying, well, I'm not sure what all my concerns were about. They're feeling relieved and that they didn't have all these negative consequences that you hear from social media science. And that was just really refreshing to me. And I hope that now that things are moving along and the mandate's not going to be released or revoked, I'm hoping that more people will go ahead and take that first step and see, like many of those who've gone before, that it's the right decision. It's a selfless decision, and it's what's right for the community.
All right, thank you, Brandon. We are ready for media questions. Who would like to start?
I'll go ahead and start. Angel Haracha with NSPR. Any word on rationing care in hospitals?
No, I think most of us have processes that we could implement if we had to, but fortunately we're not at that point. I know there are some facilities in the South, or I should say in the other parts of the country, that are having to do that, but we're not at that point.
And then one final question is, do you guys have an update when booster shots will be available in the county?
So there's a meeting of committee of the FDA this Friday, and they will be discussing the current science and making a decision about booster doses and what ages might be involved, that sort of a thing. And then following that, then CDC's Advisory Committee on Immunization Practices will meet in the next couple weeks to make recommendations and follow up to the FDA decision about that. There's a lot of planning happening at the state level in terms of just different scenarios and what that might look in terms of rolling that out. And so a lot of planning and preparation, but it's hard to actually know what's going to happen until those regulatory bodies meet and make a decision.
Thank you so much.
Hi, I'm Jordan from Action News Now. I had a question. I think this one's for Robert. So Shasta County, of course, opposes Shasta County Board of Supervisors opposed the vaccine mandate. I just kind of wanted to just make sure I clarify this. What will the hospitals be still following that? Because I know healthcare workers have to be fully vaccinated by the 30th. So yeah, that's a question for you, Robert.
Yes, the mandate will continue. For us, it's a condition of employment now, as well as mandated by the state. And I believe the federal government has recently come out as well with a mandate. So the process, there's going to be maybe a longer window than October 1. We've asked folks to have that done by October 1, but the reality is there has to be a certain amount of discernment. And much of that discernment is kind of individualized. So it's not a hard and fast rule that on October 1 folks are not going to be able to work. It'll be dependent, situation dependent.
Oh, okay. So what you're saying is, so October, the 1st of October is pretty much the date that you're saying that there's a chance that they will not be able, like nurses won't be able to work, or can you kind of clarify that for me?
I don't think I can clarify it any more than I already have. It's going to be situation dependent for the individual. I'll give you an example. So let's say someone right now has COVID and they're recovering from their disease. They might not be able to get the vaccine like they intend to by October 1. So we're going to work with that employee on that process. Let's say there are folks that, and I'll use us as a great example. So we have many people who have requested exemptions, and we're in the process of working through those exemptions right now. But I'm concerned that it's September 15, and we haven't answered many of those exemptions. So on an individualized basis, we're going to have to discern what are we going to do with these employees that have made a legitimate request, but we haven't answered it yet. So if October 1 comes, I think it's in our best interest to continue to work with each individual employee.
Okay. And right now I know there's a nursing shortage. Do you think that this vaccine mandate can maybe make that a little bit more dense for you guys to find people and stuff like that? Just because, like, I don't know personally in your staff if you had any people that don't want to get vaccinated and that are willing to quit their job.
So there's a genuine shortage in healthcare. It's not just nurses. It's lab scientists. It's techs. It's physicians. So it's across the gamut. And yes, there are folks who have said that they do not want to be vaccinated, and we'll continue to work kind of right up to that point where we can't work with them any longer. It behooves us to continue to work with people. So again, the exemption process is there. We're a large enough employer that there are some people who have said they're not going to request an exemption, and they have no intention of getting the vaccine. So again, we'll go through that same discernment process on an individualized basis.
Okay, perfect. All right, thank you for answering those questions.
Yeah. And Angel, I wanted to follow up on your question about rationing care, because that's not something that we take lightly, and it's usually something that's only done in the most dire of circumstances. So you look at during Hurricane Katrina, I'm sure there were many facilities that had to go through kind of a very thoughtful process of who was going to get care and who might be to a point where any care provided wasn't going to help them. The same thing exists within healthcare. So I don't want you thinking that, gosh, we have a process and we'll implement a process. It's an arduous task to be faced with who am I going to provide care to, and who might be at a point where any care is no longer fruitful. We're fortunate that we're not at that point. But so there is a very thoughtful process that we have, but we hope we never have to implement that.
Other media questions?
Okay, I was late to the party, so I'm trying to not ask things that maybe have already been addressed, but I wondered from the county's point of view, how frustrating is it that Shasta County has the highest COVID case rate in the state?
Yeah, it's very frustrating. And, like we did discuss this a little bit earlier before you joined, Mike, but there's a surge going on statewide, and so we're experiencing that here as well. However, most of the rest of the state is starting to come out of the surge, and we're not quite there yet. And that is typical of our area. We tend to lag behind what's happening in the more populated areas of the state. But at the same time, it's possible that this surge could continue longer here because there are more people who are susceptible to infection because of our low vaccination rates. So it is quite frustrating, and we are trying everything we can to encourage people to consider vaccination if they're not already vaccinated.
Thank you, Robin.
Real quick, can you talk more about, if anyone could jump in and talk more about the Delta variant? I know right now, we know that it's all COVID and everything, but it has a Delta variant. There's been more cases with the Delta variant. Can someone kind of explain that one a little bit more for me?
Sure. So the strain of SARS-CoV-2, the virus that causes COVID-19 that is predominant right now, is the Delta variant. And so that's worldwide. There's ongoing surveillance to identify any other emerging variants. But as of a couple of days ago, and talking on a call with the state, it's like 99% of our COVID-19 cases are attributed to the Delta variant at this time.
Other media questions? All right, hearing none, thank you all for being here with us today. Everyone stay safe and healthy, and we'll talk with you all next week.